In the clinic, I think communication with young people and being effective at it is really important. I think that clinicians who treat addiction among young adults need to be prepared to get some training in how to work with youth because they are different. I think a lot of practitioners think that because somebody is young, we should avoid using medications because we don't want to expose young people to medications. And yet, all of the studies that have been done really demonstrate that medications, when offered earlier in the course of addiction, can actually change the trajectory so that young people can get on a path to recovery much sooner and much more effectively. One story that really comes to mind that highlights to me how young adults are both similar and different in terms of treating addiction is a story of Laura. And she had been in and out of treatment programs for heroin addiction since about the age of 15 or 16. And what really surprised me about Laura's presentation is that despite having been to treatment so many times, she had never been offered a medication for addiction treatment. And so typically when someone's struggling with heroin and they're having withdrawal and cravings from the drug, we tend to move pretty quickly to offering them pharmacotherapy, medications like Suboxone, methadone, Vivitrol. She had never been offered one of these medications before, despite them being standard of care for all adults, including young adults. Some things that made treating Laura different because she was a young adult included the fact that she had a mother who was really involved in her care, which often isn't the case for older adults. And so we had to make sure that the treatment plan included Laura's mother. Often young people come to treatment with some ambivalence about treatment. On the one hand, they may want to improve their trajectory of illness. They may want to get help for their addiction. But on the other hand, their drug use may connect them with other peers, and they may not have other people that they can turn to who don't use drugs. And so clinicians really need to be prepared to navigate some of this ambivalence and to be able to talk with young people about it and work around it.
Young adults are not adolescents. Young adults are people who are 18 to 25 years old. Young adulthood is a special time of life when young people encounter important life transitions, like moving away from home for the first time, attending college, getting a first job, or even starting a family. This stage of life also brings new privileges, like being able to vote in elections and drinking legally. While these are often exciting changes, some transitions for young adults may be hard to manage, like navigating the complexities of health insurance, or moving from a pediatrician to a primary healthcare provider. Young adults experience important biological and psychological changes, like the maturing of the prefrontal cortex, which controls executive function. Executive function is responsible for careful planning and impulse control. Pictures of the brain in action show that young adults' brains work differently than adults when they make decisions or solve problems. Young adult actions are guided more by the emotional, reactive amygdala and less by the thoughtful, logical prefrontal cortex. In young adults, the executive function systems have not fully developed, making young people more inclined to take risks or be swayed by peers. Meanwhile, the reward systems of the brain are fully developed. These are the parts of the brain that make taking risks and using substances seem exciting or pleasurable, as most drugs target the brain's reward systems. This imbalance between the brain's executive function and its reward system is like having a car with a gas pedal only and no brakes. This imbalance can lead to an increased likelihood of developing a substance use disorder. The rate of addiction among young adults is higher than for any other age group. The most commonly used substances by young adults are alcohol and marijuana. In 2017, an estimated 3.4 million young adults had an alcohol use disorder, which represents 1 in 10 young adults. The same study found that 1.8 million young adults had a marijuana use disorder, which represents 1 in 20 young adults. Young adults have been affected by the opioid crisis. Heroin overdose rates more than quadrupled for 15 to 19-year-olds from 1999 to 2016. Young adults who struggle with addiction need the same evidence-based treatment that older adults receive. They should receive mental health support and medications that are shown to promote recovery. Sometimes, healthcare providers will wait until addiction gets worse before trying pharmacotherapy, and this is not recommended. Instead, providers should offer young adults medications early in the course of addiction to prevent things from getting worse. Many young adults have parents or other trusted adults who can offer support during addiction treatment and recovery. Trusted adults should always be incorporated into a treatment plan if a young adult allows it. Young adults should receive extra support with education, employment, housing, and assistance navigating the complicated healthcare system. Since many young adults come to treatment feeling ambivalent, they may not be 100% ready to make a change. Therefore, treatment needs to meet young adults where they are. A young adult may not be ready to quit drinking altogether, but may be willing to work with his or her clinician to cut back in order to reduce the harm associated with drinking alcohol. Matching treatment to readiness is critical. It can leave open the door for the young adult to make future changes to ensure health and safety. Because young adults are at an early stage in the trajectory of addiction, there is optimism. Catching a substance use disorder early has great potential for changing the course of a young adult's life and putting him or her on a path towards a happy and a healthy future.